Welcome back. June is Men's Health Month. It's a time to focus on raising awareness about a variety of issues, including something very important to fellows we don't talk about a lot, low testosterone. Now, they naturally drop the older we get, starting actually around 30 years old, so don't feel bad. It could be a problem at any age. Dr. Parviz Kavousi is a reproductive urologist at St. David's South Austin Medical Center. You've got your own practice, right, I believe, too,
yes,
as well? Let's talk about this, because guys don't want to talk about this. We get older and we get better, right? But not necessarily when it comes to testosterone.
Yeah, and you know, that's a great point. This is not typical, poker game or golf conversations that men like to bring up. And obviously, most men don't love to go to the doctor for much of anything.
Right.
But we're actually seeing an influx of patients coming in to get their testosterone checked because more and more news out there like this is getting the word out on how important it is, not for just health, but also how men feel and their symptoms.
Well, how do I feel if I have low T? Am I just exhausted? Is it the sex drive? What is it all?
It's a lot of that. So the symptoms we see when levels are low include things like lower energy, fatiguing faster, lower libido, more difficulty sexual function, more difficulty putting on muscle and burning fat. We see exercise, motivation, and tolerance decrease. It can actually affect sleep, anxiety, depression, concentration, focus. A lot of guys kind of describe they feel like they're in this fog, even from the time they wake up in the morning. Right. Guys can get hot flashes, night sweats. And then there's actually health ramifications as well. So if we're below a certain cutoff, over time we'll see things like bone loss, osteoporosis, fracture rates go up, and it actually makes it harder to regulate blood sugars in our diabetic and non-diabetic patients. So this one little hormone does an awful lot.
It sounds like you're talking about muscle mass, talking about performance in the bedroom, things like that, which a lot of guys don't want to go to the doctor to get the pill, So this is a different approach. What type of testing do they do if they come see you?
Yeah, so first we start out with just basically a normal testosterone level and just get a basic test done. It does need to be between 7 and 11 in the morning, because that's when we peak. That's why a lot of guys have a little bit less symptomatology early in the morning than they do in midday or evening, is because it's pulsatile and we have higher levels in the morning. We want to check that peak. That's what we base treatment based on. If that level is low or perhaps even borderline low, we're going to repeat it for a number of reasons. One is insurance companies want to see too low levels to cover treatment. But two is we want to be sure about that diagnosis, because we're going down a path typically to long-term treatment. Along that, we'll check some other hormones, and we'll check estrogen levels, and we'll check some of the safety things, red blood cell counts, prostate cancer screening tests, things at baseline we want to know so that we can follow when we have men on treatment.
Real quick, what is it is kind of, I don't want to say easy to fix, but it's not really invasive to fix this.
Yeah, there's lots of treatment options out there. So as treatments have developed, we've gotten more and more appealing treatments. There's still some of the older stuff out there that a lot of men choose. Things like topical gels that go on the skin that you absorb testosterone. Now, with those, you have to be careful about transferring, especially to women and children. There are things like the old injections, the injections in the muscle. They tend to do some more ups and downs. They have a little bit of a higher risk profile, but we can do those safely. Right. There are things like nasal gels that squirt in the nostrils. There is it's not new, it's several years old, but a fairly novel auto-injector pen, a lot more even keel and steady than the old shots with lower risks. And now there's even pills. There are 3 pills on the market. They're twice a day with food in the stomach. They're very safe and effective. And then there are minor procedures that some men will choose, pellet insertion under the skin that can last for several months. So there's a huge range of treatment options, and we really cater it for each individual to find what's most fit for that individual man.
And again, insurance covers it. It could change your life. Where can people come check you out if they want to get a test done?
So at austinfertility.com, austinmenshealth.com, and that's something that's very easy to test and treat. One other side I just want to mention is it's really important to have whoever's taking care of you know whether you want to still have children. Because the majority of testosterone replacements will suppress sperm counts to 0, and some men on them long enough may not bounce back to where they were. So we use a whole different set of drugs that can stimulate testosterone production in men that want to maintain fertility.
You want to do that? Well, Doc, I'm 48. I'm heading over to your place. Thank you so much.
Pleasure.
Appreciate
Thank you for having me.
We can talk about it, fellas. Jenny?